And then they put you on these two kinds of medicine called carvedilol, which you're supposed to take twice a day, and you'll be taking it twice a day. And the other one was prescribed Entresto twice a day as well. So these two medicines can definitely lower your blood pressure. So we're suspecting this is because of the medicine. Your blood pressure being low is because of the medicine. Okay, so we're holding those two medicines, and whenever your blood pressure is back to normal and steady and stable, we can restart the medicine, but at the lowest dose possible. Okay, like your carvedilol, I think you're on 12.5 twice. You can't be on 12.5. It has to be the lowest, which is 3.125, at least for now. Right, 3.125, the lowest dose, right? But obviously you need those medicines because of your congestive heart failure. But again, we have to titrate the right dose for you to prevent your blood pressure from dropping too low. Any pain here in front of your chest, right here in the middle?
Just a little bit, yeah.
Okay. And did you feel short of breath?
I do.
Yeah.
Like, it's not so much short of breath, but it, like when I go to take a breath,
Yeah.
it feels like a bunch of pressure and everything. Like it's just.
And did you throw up?
No, but I'm
You'd be nauseous, right?
Yeah, I'm waiting on medicine right now, pain meds and nausea medicine.
Did you have diarrhea?
I've been constipated, honestly.
Do you need help on that? Do you want us to give you some laxatives?
I mean,
To
I'll
help you
take
move your
them.
bowels?
Yeah.
Okay. All right. It says here you have a history of blockage in your heart. Is that correct? How many stents did you put in there? How
I
much
have
did you have?
3.
You have 3 stents. Did they do any open heart surgery?
No.
Have it bypass, okay. When was the last stent you put in?
In March.
March. Who's your cardiologist you see at the Heart and Vascular?
Dr. Saeed.
Right, I'll say on Lee Boulevard or in Oklahoma City?
Either.
See him on Lee?
Either.
Either, okay.
We prefer down here since we live down here.
All right. When was your last echocardiogram?
February.
February. Do you remember the numbers on that echo?
No, but I know it was enough to take me off my life list.
Oh, you were on life vest. Yeah, I think that's what they were saying. It was like 37% was your echocardiogram.
Yeah, because when I had my heart attack, it was like 20%.
20, okay. So we ordered an echocardiogram again to look at your heart, because obviously when the ejection fraction or the heart function is low, that also can cause low blood pressure. You know, when the heart is weak, not pumping well, the blood pressure tends to be low as well. All right. And then we also check your thyroid and the hormone levels in your body to check if those are causing your blood pressure to be low, because thyroid issue and low hormone levels can cause blood pressure also. So we're checking those as well. Those have not come back yet. Okay. So echo, that one.
They
and,
came in this morning and said that they canceled the echo.
I'll check with them. They have to redo it again. I don't know why they canceled it. So,
Because I was MPO after midnight.
oh, that was the stress test, I think. They were referring to.
Okay.
Because the echocardiogram, you don't have to be NPO. The stress test, you have to be NPO. But then I know you had a stress test in May. You had a stress test in May. So that's why we're not doing another stress test, because you just had a stress test in May.
Okay.
You know, so we don't want to do a stress test in just a matter of months.
Yeah.
But echocardiogram, you can definitely get another echocardiogram.
Okay.
So I will double check though with the
Okay.
nurses and the radiologists.
Oh, you can
make
leave
sure
it.
They're not answering the
Like,
echo.
we've been here
Because
so
we
many
know your heart
times, we-
function at this time.
We know how to do it.
What
Yeah.
it is now.
So don't worry about it.
But
Oh,
it's okay for you not to go for another stress test because you don't need another one.
Okay.
Have a quick fact on
All
that.
right, so any blood in your stool or black stool or, okay, very good. Stomach pain?
Nothing more than,
Nothing.
yeah, normal. I don't have a gallbladder,
You
so.
don't have a gallbladder. Let me listen at you, okay? Did they tell you, has anybody told you you're having large lymph nodes in your chest, around your lungs?
No. Is that,
Yeah, so it's something that needs to be followed up as an outpatient. Your doctor, one of your doctors, your primary care doctor especially, should do a repeat CAT scan of your chest in like 3 to 6 months.
okay.
So make sure you bring it up to them that you've got multiple enlarged lymph nodes there. We don't know what it is, what's the significance of it, but we don't think it's causing you the chest pain or the blood pressure to be low right now, okay?
Okay.
So, but it's something that needs to be followed through.
Sorry. Oh, no, you're fine, you're fine.
Yeah, but it is something that needs to be followed through.
And you,
So
and
need
you said,
another-
I'm sorry,
Enlarged lymph nodes.
lymph nodes?
Lymph nodes.
Lymph nodes, okay.
Yeah, so you have enlarged lymph nodes.
Enlarged
And
lymph nodes,
that needs to
okay.
be re-examined.
Okay.
And you may need some other testing to find out, like a biopsy maybe, but you need a repeat CAT scan first. If the CAT scan show that
Thank you.
Yes, ma'am.
the lymph nodes are growing or they're changing character, then the next step is really to do a biopsy on one of those lymph nodes, okay? So it's around your heart, actually around your chest, well, in your chest, around your lungs, around the middle of your lungs.
Okay.
Between your heart and your lungs is where the lymph nodes are, between the heart and the lungs, okay?
Okay.
Yeah, in the middle. All right. So again, we don't think it's anything to do with your blood pressure being low or your chest pain here or the pain here that you're experiencing. Does sarcoidosis run in your family? Is that something you've heard? No. Okay. That's one of the differentials. It's just a condition, a lung problem, wherein people develop scarring of the lungs. So it's an autoimmune, it's a genetic condition.
Okay.
Genetic condition where the lungs start to scar out for no apparent reason, because of genetic problems. And when they scar out, so the lungs then, the patients then develop difficulty breathing, and they start to have to be on oxygen, that kind of stuff. But that's one of the differentials, but we don't know it right now, because the best way to diagnose sarcoidosis is do a biopsy. But usually it starts with the blood work. So I can run a blood work while you're here, but the result may not come back so soon. Who's your primary?
Dr. Argento?
Yeah, so very good. So Dr. Argento has access to our records here.
Yeah.
So I'll run a test for sarcoidosis, which the result may take 2 weeks to come back. So
Okay.
you can ask Dr. Argento to try to find out what the result was. It's just a screening test we do. But even if this blood test comes back normal, then you still need another CAT scan and maybe a biopsy later on, okay?
Okay.
Even if the blood work comes back normal. So
Okay.
go ahead and run this blood work because you're here in the hospital.
Thank you.
Yeah. So let me listen to you real quick.
So is there a chance that she's going home today?
No, you're not going home yet. You need to make sure we stabilize your blood pressure.
Okay.
Okay.
And again, we want another echocardiogram for you. I did 2 hormone level check to make sure your blood pressure is not because of some hormonal deficiencies, kind of stuff. So that will come back probably tomorrow morning, the results, okay?
So she is doing a eco.
Yeah, should be. If they cancel it, I will make sure they do it. I'll call them
Come in.
and
Okay.
verify if that's actually what they're referring to, that they canceled. Maybe they meant something else, okay?
Yeah.
Right.
All right.
Thank you.
No problem, thank you.
All right. Thank you, doctor.
You're welcome.